Hello everyone, I'm Elena Menchi from the Unit of Pharmaceutics and Biopharmaceutics of the Université Libre de Bruxelles, ULB. The topic of this presentation is the determination of an appropriate dose ratio of a synergistic combination of long-acting bronchodilators for the maintenance treatment of asthma and COPD. Significant improvement in symptoms and pulmonary function of asthmatic and COPD patients were shown when combining long-acting bronchodilators such as a beta-2 agonist LABA with a long-acting muscarinic antagonist LAMA. Indeed, the resulting bronchodilator effect on the airway smooth muscle could be enhanced thanks to their various mechanisms of action. The therapeutical regimen could be improved to a once-daily regimen due to the long duration of action of the drugs. Combining drugs with a common effect could also lead to dose reduction for each drug compared to the administered dose in monotherapy. Finally, the use of a single device containing both drugs and the reduction in the number of times the drugs are taken makes the patient more compliant with its treatment. This results in improved patient-reported outcomes. Approved or promising drugs for the treatment of these both respiratory diseases were used to investigate how the benefit of combining these drugs could be synergistically improved. To do so, some drugs were selected. Formoterol fumarate, which is widely used in asthmatic patients and which is characterized by a rapid and long-lasting action over 12 hours. Indacaterol maleate, which is characterized by a duration of action over 24 hours. These two LABAs were each associated with tiotropium bromide monohydrate, first LAMA approved to treat both asthma and COPD. The experimental model used to study the effect of the co-administration of drugs on the smooth muscle tone was a model of isolated perfused guinea pig tracheal rings. The guinea pig was chosen as it presents an appropriately sized organ and many similarities to human airways in terms of receptor pharmacology. The isolated tracheal rings were mounted on metal rods and placed in organ baths containing a physiological solution maintained at 37 degrees and gently mixed with a gas containing 95% of oxygen and 5% of carbon dioxide. Changes in isometric forces were measured and recorded on a computer. The assessment of the relaxation was carried out on pre-contracted tracheal rings by multiple additions of the drugs in a cumulative manner to generate semi-logarithmic concentration relaxation curves. These curves were used to highlight LABA-LAMA dose ratios, generating strong synergistic interactions. These interactions were studied using two widely used pharmacological models, as there is currently no ideal model for the analysis of pharmacological interactions. The first model, called Bliss independence theory, is used to identify the synergy by an accurate statistical analysis. Additivity is calculated thanks to an equation, and if the observed effect value, meaning the experimental value, is higher than the calculated effect value, meaning the expected effect value, the interaction can be considered as synergistic. Furthermore, the 95% confidence interval must be positive to select the dose ratio. The second model, called unified theory, gives the level of interaction. This level depends on the combination index value. This value was calculated with the software. This software can also estimate the dose reduction index, which is defined as a measure of how many folds the dose of each drug in a combination may be reduced at a given effect level compared with the doses of each drug administered alone. The complementary approaches of Bliss independence theory and unified theory models and their applicability to various experimental systems seem to be relevant for the determination of those ratios of new and existing inhaled LABA-LAMA combinations. Therefore, this work aimed to identify those ratios of LABA-LAMA combinations resulting in synergistic airway relaxation and to quantify them based on an isolated perfused organ technique and using pharmacological models. Then, an appropriate dose ratio can be highlighted from the resulting data and will help for the future development of optimized combination of LABA-LAMA medication for inhalation. This is done to optimize the benefits of the co-administration of these drugs in the treatment of asthma and COPD. First of all, preliminary experiments were conducted to define the amounts of drugs to combine. The first step was to define the potency of each drug using the negative logarithm of the concentration giving 50% of the relaxation value, the PEC50. The resulting values were obtained based on individual drug relaxation curves and showed that tiotropium was more potent than the other tested drugs. Then, a screening study was conducted among a large range of dose ratios in a cumulative dose approach. Each time new amounts of drugs were added to the bath, the dose ratio changed. This study was based on the individual drug relaxation curves results and on the doses usually used for the marketed drugs adapted to the animal model used in the study. For each LABA-LAMA combination, only the two first dose ratios showing synergy were selected due to the cumulative nature of drug additions to the bath. The graph shows the shift of the relaxation curves when the LABA is added to the LAMA tiotropium, so it illustrates the value of combining two classes of bronchodilator drugs. New relaxation curves were generated for the dose ratios previously selected at a constant dose ratio by varying only the amounts of drugs cumulatively added to the organ bath. Synergistic interactions were shown for all combinations, but only from a certain concentration, depending on the combination and dose ratio as shown by both graphs, above 0 for the left graph, under 1 for the right graph. As the aim is to determine an appropriate dose ratio of LABA-LAMA combination resulting in synergistic airway relaxation, the dose ratio showing strong synergy and leading to the best dose reduction when compared with the same drugs as monotherapy was chosen to be formulated. Based on the Bliss-independence theory, the strongest synergy is represented by the greatest difference between observed and expected effect values, in blue on the left graph. This result was confirmed also by a low combination index value. So, the combination 4-2 with a proportion 2:1 seems here to show the best result, even if it's not significant. Based on these results for a defined combination, it seems that promoting a combination with lower concentrations could lead to stronger synergistic interactions, as also reported in the literature. Indeed, synergy was found for all combinations tested, but only beyond a certain dose cumulatively added. 4-2 with a 2:1 proportion was chosen in this study because it showed the earliest synergistic interaction and a greater magnitude of synergy than 4-2 with a 3:1 proportion. Complementary kinetic studies with the selected amounts of drugs will be performed to confirm this synergy and to refine the selection of the appropriate dose ratio without the influence of previous cumulative additions of drugs on the resulting relaxation, while assessing the airway relaxant effect over time. The use of an ex vivo model, such as kinetic tracheal rings, to highlight appropriate synergistic dose ratios of LABA-LAMA combinations, represents a promising strategy before the formulation step in the development of optimized LABA-LAMA combinations for inhalation in the maintenance therapy of asthma and COPD. However, synergy is not limited to the selected dose ratios. In addition, the data collected in the context of this study must be set against the limitations of the experimental model and drug interaction pharmacological model. Therefore, due to these limitations, the synergy at the selected dose ratio first requires confirmation on a preclinical model of asthma or COPD by assessing bronchodilation through measurements of lung function before proceeding to clinical trials. To conclude this presentation, I would like to thank my department from the ULB and my partner ScienceAnno for the help and the support. Thanks also to the FNRS for the funding of my research projects. Finally, thank you for watching this presentation. If you have any question, feel free to contact me by email.